How to make relapsed Ewing sarcoma treatment choices. When faced with relapsed Ewing sarcoma, making treatment choices can feel overwhelming. Understanding the factors involved is crucial. Treatment decisions depend on the type and timing of the relapse, how well previous therapies worked, and the overall health of the patient. First, let's talk about the type of relapse. There are two main types: local relapse, where the cancer returns at the original site, and distant relapse, where it spreads to other parts of the body. Generally, patients with local relapses have better survival outcomes compared to those with distant or combined relapses. The timing of the relapse is also important. If the relapse occurs more than 2 years after the initial diagnosis, the outcomes tend to be more favorable than if it happens within the first 2 years. Next, chemotherapy is often the backbone of treatment for relapsed Ewing sarcoma. Combination chemotherapy can significantly improve survival rates for those who respond well. Newer agents, such as regorafenib, are being studied alongside standard chemotherapy to see if they can enhance outcomes. However, these are still under clinical investigation and are not yet standard treatment. Surgery can also be a key option, especially for local relapses. If feasible, removing recurrent tumors can lead to improved survival. In some cases, radical surgery may be considered to eliminate all detectable disease. Radiation therapy is another important tool. It can target bone tumors or metastatic sites, either aiming for a cure or providing palliative care to relieving symptoms and improve quality of life. For patients with lung metastases, whole lung radiation may be applied after chemotherapy to help consolidate the treatment response. Stem cell transplantation is an option for some patients who respond to chemotherapy. This involves high-dose chemotherapy followed by using the patient's own stem cells. This approach has been linked to improved survival in selected cases. Participating in clinical trials is highly encouraged. Relapsed Ewing sarcoma remains challenging to treat, and clinical trials can provide access to new therapies that are not widely available. It is essential to personalize treatment planning. Each decision should consider factors like the patient's age, previous treatments, the site and extent of the relapse, and overall health. Consulting with a multidisciplinary team of oncology specialists experienced in bone sarcomas is vital for tailored treatment. In summary, making treatment choices for relapsed Ewing sarcoma involves assessing the type and timing of the relapse, using combination chemotherapy as a foundation, considering surgery and radiation when appropriate, and possibly incorporating high-dose chemotherapy with stem cell rescue. Engaging in clinical trials can also be beneficial. Always consult with specialized healthcare providers to ensure the best approach for the individual situation.